Hi, my name is Whitney. I'm a nurse practitioner student. I'll be examining you today. I'm just washing my hands here. It's also Bring Your Baby to Work Day. I hope you don't mind.
That's okay. She's cute.
Okay, and what's your name?
My name's Andrea.
Andrea, it's nice to meet you.
Nice to meet you.
And what brings you in today?
I've been just feeling sort of short of breath.
Okay, just a few identifiers. Can you tell me your name, your birth date, and we already said what, or where you are. Your name, your birth date, and where you are today.
Okay. Andrea, my birthday is July 4th, 1957, and I am at Research Medical Center.
Okay.
In the clinic here.
Andrea is a 60-year-old Caucasian female, and she's alert and oriented ×3 because she knows her name, birthday, and where she is. She comes in for shortness of breath. Andrea, can you tell me the onset? Like, when did it come on? Or, I'm sorry, not when, but like how? Did it come on suddenly or progressively over time?
I would say it's all of a sudden.
Okay, sudden onset. And the location, like where you're feeling it?
Just in my chest, lungs area.
Okay. And does it radiate anywhere?
No.
No,
Not really, just stays in the chest area.
Confined to the chest.
Yeah.
Okay. And the duration? How long have you noticed it going on? Days, weeks, months?
It's been about 1 week. It's been pretty constant, though, at least for the last few days.
Okay. And the character? If you could describe what it feels like, if you've ever felt something like this before.
I just feel like I can't really catch my breath. I don't feel like I'm, dying, but just that I just can't catch my breath, and my heart seems to be beating a little faster than usual.
Okay. All right.
Yeah.
We'll definitely get you checked out. Is there anything that you've noticed that aggravates the shortness of breath?
It just never really goes away. Exertion, like when I walk my dog, that seems to make it worse. And then rest does help a tiny bit, but it's still usually there.
So you've noticed some alleviating factors would be rest.
Yeah.
Anything else that makes it worse or better?
Not really. I just got a carpal tunnel surgery a few weeks ago, I think it was 2 weeks ago.
Okay, that's definitely something worth telling me. Thanks for letting me know.
Yeah, and then this seemed to start, I think, probably a week after that, and I've never had these symptoms before, so it's just kind of weird.
Okay, so new onset of something you've got going on. And the severity, not necessarily pain, but severity, like 0 being your breathing is fine, 10 being like panic, anxiety attack, can't breathe at all.
I would say it's about a 3 to 4. Like, it's not horrible, just feels weird.
Okay, a little harder to breathe and catch that breath than normal.
Yeah, and no pain at all anywhere.
Pain is 0 on that 0 to 10 scale, you're saying?
Yep.
Okay, that's good. So some general questions here related to other symptoms. Have you noticed any dizziness or lightheadedness?
No.
Loss of consciousness?
No.
Chest pain or palpitations lately?
No, not at all.
Okay. Restlessness or confusion?
Oh, definitely not.
Okay. And you seem very coherent and cooperative today.
Mm-hmm.
Any swelling?
No.
We'll assess that in a moment, but have you noticed any edema or like your socks leaving a line on your ankles or anything?
No.
Okay. Weakness or numbness?
No.
Arm pain or back pain?
No.
Okay, so we've likely ruled out stroke symptoms. Always want to do that in a female, especially with those unique symptoms on how it may present. Fevers or chills you've noticed, Andrea?
No.
Okay, weight loss or weight gain?
No. Stayed about the same weight for a while. So.
Okay, we have you weighed about 120 today, so that hasn't gotten any different. Clothes still fitting the same?
Yep.
Shoes still fitting the same?
Yep, still 6.5.
Okay. Any headache you've noticed?
No.
Okay.
Not unless I don't drink enough water.
Okay, so with that trouble breathing, have you noticed any wheezing or coughing?
No.
Okay, and you already denied chest pain and palpitations, so that's good. Lastly, just continuing to rule out stroke, We already said no confusion, no weakness or numbness. How about visual changes or speech problems?
No.
Okay, and I'm not noticing any asymmetry in her face or slurring of speech or any problems that could point towards stroke in this older female. So that is ruling out stroke. Past medical history. Have you had any significant diagnoses?
Just some anxiety.
Anxiety. No high blood pressure, high cholesterol, anything cardiac related?
No, my mom and dad both had high blood pressure. But other than that, we had no family symptoms of stroke or heart attack or
Okay. So mom and dad had high blood pressure. Are they still living?
Yeah, they're both in their 80s.
Okay. 80s, still living, just hypertension. That's
Yep.
pretty healthy for that age. Any siblings?
Nope.
And it looks like you're married. You have a husband, but no children I'm seeing in your chart.
Yeah, we decided just to not have any kids.
Okay.
It seemed like a lot of work.
Okay, they are a lot of work. Any family history of stroke or heart attack?
No.
Okay. And past surgeries, you mentioned the recent carpal tunnel on the right side. Any other surgeries?
No.
Okay. So this was your first surgery then, just a few weeks ago.
Yeah.
So you were pretty darn healthy.
Yeah.
First
And I
surgery
did
at
not like it.
age 60. Okay. According to your record, your immunizations seem up to date. You had a recent flu vaccination. That's good. A couple of weeks ago. How about well woman or pap smear?
Oh, yeah. I had one about 3 months ago, and they said it was normal.
Okay. Mammogram around that same time?
Yep. And that one, they said was normal, too.
Okay. Colonoscopy? Since you're over
About 2
50?
years ago, I sort of put it off, but they said it was normal. So.
Oh, good. Yeah. Well, I'm glad it was normal after you put it off
Same
8 years.
here.
Okay. Some more questions, then we'll get to the exam. I'm assuming, have you hit menopause? Are you menopausal
Oh, honey,
or still
my
have a cycle?
menopause was in 2010.
Okay. So
Thank
no
God.
last menstrual period to make note of. You mentioned you live with your husband, no
Yep.
children. What do you do for work, Andrea?
I teach high schoolers.
Oh,
I have
okay.
the patience of a saint.
Okay. Yes, you do. And do you feel safe at home or ever
yeah,
had thoughts
definitely.
of hurting yourself or others?
No.
Okay, those are just some questions we ask everyone that walks in the clinic. How about your medication list?
I take a multivitamin when I remember, just one a day. I do take a little baby aspirin. I think it's 81 milligrams.
Oh, that's wonderful.
Yeah, I just decided one of my doctors told me years ago to take it, but
Good.
and then I do take a Xanax just
For that
probably
anxiety.
once a week, and yeah, for my anxiety, I think it's 1 milligram.
1 milligram as needed.
Yep.
Baby aspirin and multivitamin. Any other herb supplements or over the counters?
No.
Okay. Recent Sudafed or anything?
Oh no,
Okay.
stay away from that.
Okay. Are you allergic to any medicines, foods, or environmental?
No allergies I know of.
Okay. Tobacco use? Ever
Oh,
tried
no.
it or used it regularly?
Gross.
Alcohol use? How many drinks per week and days per week?
Like 2 to 3 glasses of wine on the weekends.
Okay.
Just
Not a
small
daily thing?
ones. Oh no.
Okay. Ever used drugs?
Nope.
Okay. And you mentioned a dog. You get more short of breath walking that dog. Is that your only pet at home?
Yeah, just my golden doodle Tuggles.
Okay. And has anyone, you or anyone close to you recently traveled abroad?
No.
Okay.
No.
So, Andrea, thank you for answering all those questions.
You're welcome.
We're just trying to get down to what's going on. So, Andrea is dressed appropriately for the weather today. She has a very pleasant affect. She is alert and oriented ×3 as we previously assessed. And my medical assistant took her vitals. Her temperature was 98.6, which is normal. Blood pressure 110/58, which is also normal. Oxygen saturation was 99% on room air. Her height was 5 foot 5 inches and her weight 120. So she is within a healthy normal BMI range. I haven't calculated that, but probably mid to low 20s. So no obesity risk factor. So Andrea, if you don't mind, I'll just go ahead and start assessing your cardiac. Okay, if you could lift that breast up for me, I'll listen to the apical pulse for 1 full minute. Okay, now I'll listen with the other side. Okay, so I did note Andrea's pulse was about 114, the same that my medical assistant got when I listened to her PMI, or apical pulse. I heard a normal S1, S2 with no murmurs, gallops, or rubs. I'll go on to assess any edema, although she's denied that. Assess capillary refill, clubbing, and cyanosis. So if I can have your fingers here. Okay, no clubbing or cyanosis noted in those fingers. Radial pulse was not weak or bounding. It was about 2+, which is normal. I'll assess these extremities. Do you mind if we take your socks off? Okay, thank you. Might not be able to see here, but I'm assessing her pedal pulse. Capillary refill on the toes. No edema, normal hair growth on those legs. Have you noticed any thinning of hair on your lower extremities?
No.
Okay, it's even hair growth. No shiny skin noted. Assess this one as well. Also about 2+ pulses on the pedal pulse bilaterally, and capillary refill less than 3 seconds on upper and lower extremities. So again, pulse 114, no edema, capillary refill less than 3 seconds, which helps rule out heart failure, which is one of my possible diagnoses. No clubbing or cyanosis was noted on that cardiac examination. Pulses were 2+, radial and pedal, which also helps you rule out heart failure, since she's getting nice output to those extremities. I would go ahead and also get an EKG, and my EKG would reveal likely atrial fibrillation if I were to run one of those. Now I'll go ahead and assess her respiratory system. If you could take a deep breath for me, Andrea. There we go. I never turned it back from my bell. As always, we listen to the heart and lungs under the clothing, but for privacy, we'll let her keep those on. Probably not a lobe down there, but I'll have you lift up this arm. Okay. I'm going to move your hair out of the way if you don't mind. Listen to all these lobes under the clothes. Want to get way down below her bra strap, just to the base of the diaphragm. That's where we would also catch crackles in the lungs if she were exhibiting signs of heart failure. Okay. Respiratory rate is a little on the high side of 20. Respirations were even. I did not hear any adventitious sounds like crackles, wheezes, or rails, especially crackles at the base of the lungs, which would indicate heart failure. Peripheral vascular, when I was assessing those lower extremities especially, I didn't note any warmth or redness of the legs, no decreased hair growth or shiny appearance of the skin. So those are my 3 systems, heart, lungs, and peripheral. My first possible diagnosis would be persistent AFib. I would say it's likely AFib because of the sudden onset and her recent surgery. Also the tachycardia. I would probably refer her to a cardiologist and educate the patient on when to go to the ER and tell her to keep taking that baby aspirin. Maybe even up that to a 325. I would likely not diagnose her with heart failure, not that we're diagnosing in this class, but not likely heart failure because there is no edema, no crackles or fluid heard on the lungs, normal pulses in those extremities, and she denies weight gain. All things that would appear with signs of heart failure. My other possible diagnosis, I know it goes with the lungs, but I liked it better than others for sudden onset of shortness of breath. And it's very common, so I wanted to learn more about this. I chose pulmonary embolism, but I would rule that out because she denies chest and back pain. Her O2 saturation was 99 in room air. I'm not completely ruling that out actually because she is at risk with that recent surgery, and I would likely get a chest x-ray to completely rule that out. So with that recent surgery, she is at risk for these things, but my gut is telling me, and my EKG tells me AFib, but I'm still concerned she might have a PE, so I'd probably rule that out with chest x-ray. Any questions, Andrea?
Nope.
Okay. Hope I'd cover that, and thank you for putting up with Take Your Baby to Work Day. Husband's on a boy trip. I could really kill him.